All right, welcome everybody to day 2 of Koopmans Lecture Series. I'll just give you a few minutes to arrive. So we're talking about psychosocial oncology research and practice with Indigenous communities, unique issues and key considerations. We had a wonderful session yesterday, and we hope many of you are returning for our second day. I'll just give a minute for people to arrive here. So let me introduce myself. I'm Dr. Carlson. I'm a professor in the Department of Psychosocial Oncology at the University of Calgary. I'm head of the planning committee for the Koopmans Lecture Series. And let us begin with a land acknowledgement. We acknowledge that what we call Alberta is the traditional and ancestral territory of many peoples presently subject to Treaties 6, 7, and 8, namely the Blackfoot Confederacy, the Kainai, Piikani, and Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and the Tsuut'ina Nation, and the Métis people of Alberta. We acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. Now, yesterday we had Jan Koopmans do an introduction to the Koopmans Lectureship, which was really nice to hear a bit of the backstory. This speaker series is supported by the Katherine Porikos Koopmans Lectureship in honor of Kathy Porikos Koopmans, who was a researcher and in obesity research and metabolic research, but also had an interest in psychosocial oncology. Unfortunately, she died young from a breast cancer diagnosis, but she wanted to see the research continue in this area. So her late husband and her mother established the Katherine Porikos Koopmans Lectureship, and that's what brings us here today. So the lectureship supports distinguished visiting speakers presenting a lecture on psychosocial oncology, and it's managed by myself through the Division of Psychosocial Oncology. So today our schedule is going to begin with BigSmoke, who is an Indigenous patient navigator with Alberta Health Services and part of the planning committee. She will be introducing our speakers and our discussant. Then we'll have our two speakers, Ms. Leah Bill and Dr. Rita Henderson, followed by a moderated discussion. Hopefully our moderator from Australia is going to arrive. If not, we'll figure it out as we go along, and then an audience Q&A. So please, as yesterday, if you want to put a quick note in the chat, where you're coming from, where you're joining us from, whether you're from Alberta or elsewhere across Canada or around the world. And as questions arise, as we're going through the lecture, feel free to put them in the chat box, and you can just preface your questions with a heading question to distinguish them from the comments. All right, so now I'm going to turn it over to Arrow to do the introductions of our speakers. Arrow, you're on mute.
Thanks, Linda. It's my great pleasure to introduce our speakers and discussant for today. Our first speaker is Leah Bill. She's a registered nurse and Indigenous knowledge practitioner. Leah has been the executive director of Alberta First Nations Information Government Center since 2019. She has also been an Indigenous advisor and Indigenous knowledge holder for several national health organizations. And Leah has served as the president of the Indigenous Nurses Association of Canada and is a traditional practitioner that applies the integrated approach to practice. She combines Indigenous knowledge with nursing knowledge and has worked as a frontline nurse in First Nations communities for over 30 years. This firsthand experience as a nurse has led to specialization in Indigenous health research, including community participatory research, cross-cultural awareness health promotion, and program development and evaluation. Leah is a co-investor with AFNIGC on the $500,000 emergency department project and is a principal investor on the Indigenous Healthy Life Trajectories. and it is a partnership with the University of Alberta. She has co-authored recent publications in the areas of health service, research, and health provider education, including barriers and facilitators to health services using decolonization theories and qualitative methodologies.
So now we are going to turn it over to Leah. Let me pin her on here and I will share her slides from my end. All right, if everyone can see that, take it away, Leah.
So I'm a fluent Cree speaker and just greeted you in our language. The Atamskatna means that I meet with you in the middle or in the sacred space. So there's other ways of saying hello, but Kitatamskatna is a very formal way of saying I greet you and enter that space with you. So maybe we can start with the next slide. Also, I just want to thank you, Linda, for doing the land acknowledgement. Really appreciate that, doing that on behalf of all of us here today. I'll tell you a little bit more about myself in terms of, I know that Arrow has provided you with an introduction of my bio, but I have to acknowledge my grandmother who actually raised me. I am the eldest daughter of 11 children, and our custom is that the eldest daughter is often handed over to the grandmother. And so I was very, I guess, fortunate that I was a firstborn and had the opportunity to live much of my life with my grandmother in the early years. And so we spent a lot of time in the bush. I didn't go to school initially. I went to school later. And so my first schooling was those traditional teachings and really gaining a very clear understanding of our language as well and how that influences our life and carries us forward. And actually she also recommended or strongly recommended that I go and become what she referred to as a white medicine woman, and that was nursing. So she had a very big influence in that area. So with this talk, I'm planning to speak a little bit about cancer and what it's called from an Indigenous language perspective, because I think that provides you with a little bit of understanding of how we reference cancer as Indigenous people. Secondly, defining health from an Indigenous perspective in terms of the knowledge and understanding of the determinants of health. Principles of healing. Now, this is based on my teaching and what I've received. And then just do a comparison with the Caron care system and what it really means from a healer's perspective entering in that system. And then also to talk a little bit about the seeker, which is the patient, for the care and the healing, and then that experience that I've witnessed, but also I think many researchers are now beginning to have a glimpse of what that experience is like. And then really looking at research, Indigenous knowledge, and the psychosocial experience. So I'm taking the angle more of not just from the seeker, the patient, but more from the researcher perspective and the psychosocial experience around that as Indigenous researchers. And then I'll wrap it up at the end with some concluding thoughts. So next slide. So in Cree, we describe cancer as manchusak. Manchusak can be referred to as bugs or little gods. And because the smaller little crawlers actually are considered to be the helpers and the workers of the underworld. And they not only have this incredible ability to support life, but also they can, in some ways, overcome life or take it over. So when we're referring to cancer, it's a recognition and acknowledgement really of how powerful or how difficult it is to overcome that disease once it sets in. We have had the honor to work with Blackfoot elder knowledge holders, and when we did our work on the cancer prevention and screening work, as well as our Canadian Partnership Against Cancer project, we worked with elders and really looked at trying to define the words on how we describe cancer. So the word to describe cancer in Blackfoot, and I hope I don't massacre this word because I'm anitoxkatsi. So that word is it describes, again, a little creature, something like a spider or an octopus, like it has many legs. So our dear elder Dorothy Day Chief was the one that sent me the word. She even sent it to me to listen to it on the, but I'm sure I didn't exactly pronounce it the way she taught me. The other one, in doing a little bit of digging around to see if there were other languages that had described the word cancer, is the Inuktitut. They describe it as gaguti. So this, again, it's being knocked down out of natural order. So rather than using the word cancer, when we reference cancer from these indigenous language perspectives, you can see already from a psychological and even a social perspective how cancer itself is held in such a way that people recognize its power, people recognize that it has the potential to have great impact on one's life. So next slide. So understanding healing. So as a healer myself, having worked with many different levels of community, as a practitioner, not just as a healer, but even in the nursing field, our ways of knowing are linked to many, many bodies of knowledge. So when we enter into this role or accept that role as a healer or a facilitator of healing, part of our training involves being connected, especially to the land and all of the medicines, but also there's layers within there, the animals, the spirit helpers. And so there's many pathways. And so to become a full, well-rounded traditional practitioner or healer, there are different phases of your life that are dedicated to certain pieces of work. And part of that is also connecting back to your ancestors and your family system. The plants, the cosmology, and the ceremony. So as you're developing your skills and as you're, I guess, advancing your knowledge, then things are added on. So some folks may take I guess, a pathway that's very specific, but then you will have generalists that have the capacity to do many things. They not only work with medicine, but they work with the energy, they work with the animals, they work with the plants, they work with in ceremony, and then the other greater field. So my work has primarily been in the area of working with spirit, but also connecting to all of those other pieces of knowledge, bodies of knowledge. So in the role and positioning of the person and seeking healing and support, again, that's extremely important. So we're never above somebody who comes to seek for our healing. We actually, our positioning is never that we know better. We are positioned with our seekers or our individuals that come for help as merely the facilitator. So we create the space and the opportunity for whoever is seeking to receive whatever spirit guides or deems to be what's in the highest and best interest of that individual, and or whatever the medicines. And so when one is receiving medicine, it's not always the same prescription. So we can say that from a traditional healing perspective that it's person-centered medicine. It's not like Westerners prescribe. You get the same prescription and it's based on your body weight or and all that kind of stuff. That's not necessarily how it's done. There's a lot of other elements that are considered. So first of all, that first sitting with the patient, you're talking about family, you're talking about life experience. What are the events that potentially may have led to where you are now? And those protocols for the practitioner and the person that's seeking are also quite extensive. The belief is that while not necessarily money's exchanged, but the gifting is exchanged. So, and it's based upon whatever the individual has capacity to provide. So there is never any what we call a pay scale or anything like that involved. It's generally whatever the person can come and seek. And sometimes there is a trading. There is a trading that happens between the seeker and the medicine person. So sometimes a disease will bring you to that medicine person because maybe that was the only way that spirit could get you there to come and learn or to acquire a skill or a piece of knowledge that would help you to move on in your true purpose in life. And so this is why all diseases are considered to be teachers. They're considered to be facilitators and to direct you along your true path in life. If you especially have not been listening to the calling that has been given to you. And then understanding those responsibilities of the practitioner and the seeker. So the spiritual relationship with the medicines and with all of the bodies of knowledge. So we don't have specifically what you would call an ethics committee, or even, for example, if you go to become a doctor or a nurse, you have a registering body that actually oversees you. To make sure that you stay within the boundaries or within your practice. Our ethics committee are our ancestors who are working with us from the spirit realm, but it's also all of those spirits that are part of the bodies of knowledge that you are working with. So whether it's an animal teacher or a spirit that has come to you in a dream and has adopted you as their student, then that one makes sure that you follow. And believe me, when you're very well connected and you're listening and you're paying attention, you hear, you feel exactly when and how you need to conduct certain things. And if you step out of line, you also feel that right away. So next slide. So in defining health from an indigenous lens, it's really, I think, really critical. What we have found in doing the research work, especially working with the knowledge holders, is we're seeing and experiencing that really the language is very, very critical. But also we understand that the knowledge and the understanding of health really lies within the land itself, the culture, the ceremony, foods and medicines. It's not separate, because that's what defines health. So if your environment, for example, if the food that you're not eating is not healthy, it will define your own health. The land itself, if you're not connected to it in the way that it was originally deemed, that's why land base is so critical. What we find is those folks that, for example, don't have opportunity to be out in nature or to be actually on the land, experience a greater sense of disconnect and do experience more psychosocial types of stresses as they go through life. Defining health from an Indigenous lens, I think it really requires researchers and health practitioners to have a deeper understanding of what healing space means, what the role of healing space is, and how that affects people, and how it's applied to health practices for implementing research. Without that understanding, you're only grasping a very superficial layer of the knowledge and information that will actually help to bring about change or a deeper understanding of really what's happening as far as the health experience is concerned for Indigenous people. And I don't think I need to elaborate too much more on that, but really, I think if you don't really fully understand that everything has an influence on health and how people perceive health or how they translate health for themselves, all of those pieces need to be understood. And our tendency, I think, from a Western perspective, is to look at one little piece and look at it in a microscopic way without those other pieces. So, which leads then to potentially misunderstanding or mistranslation. So the language itself underpins the translation of health concepts. And as I'll refer back to the description of cancer in our own language. So when I refer to cancer as a manjus, compared, and if I use just cancer, very, very different. Even in my tone, our voice actually has different levels of tones, and that it also plays a part in the description and defining one's own health. So if you've lost your original language and you're not able to enunciate properly, then that too has a really deep impact on your physicality, but also your mental, your emotions, all of that. So this is why language is so critical, and the real, I think, effort that's being made to repatriate and to reinstate language in our communities and with our children, because that has such a powerful impact on their whole being. The historical experience is interwoven into the concept of health, and we see that now. It's very evident with the residential school impact, and it's very much woven into our being, or the being of those that have had that experience. And if you think about all of the individuals that were in the actual experience have already transferred that experience to the future generation before they were actually even born. So, for example, everything that my grandmother experienced, I already had that before I was even born, because I was part of my grandmother's, I was in her, before I was even born. Because when she had my mother as an egg, I was already in there. So you can see how the transference of historical experience goes on and on and on. So all experiences, that's the way it is. So when you can think of it that way, then you begin to realize that my work today has already had impact on several generations. And the number that's often used is seven generations forward and 7 generations back. So when you begin to think of your work, it doesn't matter, or your actions or your decisions, every single decision, every single action that's taken already has that ripple. So the Cree principles of healing, again, when we're looking at this, it's really important we come from a space of understanding the concept of miracles and the role of spirit and connections. So I know in the medical profession and in the nursing profession, this is kind of an afterthought. Where in nursing school, I really had a difficulty with this, because whenever a person got a diagnosis, there was already a decision made on the end date. And we find that with cancer, whenever you get a diagnosis, and this was talked about by many patients that I interviewed, and they said, what right did they have to tell me the day that I'm going to die? And I said, they have no right. That's between you and the Creator. So a diagnosis doesn't mean that you're going to die within a certain amount of time. So our practice is generally to say, okay, you've been handed something challenging. You've been handed something perhaps maybe that you need to live with and work with and come to understand, and see how that can help you to grow in some way. Or is it related to something else? But that's the journey. That's the journey of discovery. So all living things are of spirit. That's the invocation of spirit, the Creator as the primary driver and the practitioner as the conduit for opportunity to heal. So that's our role as traditional practitioners, as we're facilitators. And so looking at the person and the cancer in the center. So again, often fellow healers and traditional practitioners and elders have always said, you don't embark on a war against cancer, because that's fruitless. Like, it's not going to lead you anywhere. So the best thing is to sit down and say, okay, where are we at? And then you invoke in the spirit of the medicine and that invisible, whatever it is, heart, the compassion, all of those components that are really linked to the essence of the human being. And then you look at your physicality, the impacts, and then of course the space. And for us, it's all, the space is really about connecting to the natural world. That's where the pharmacopoeia is, like the whole, it's infinite, and anything is possible when it comes to healing. And of course, there's a lot of other protocols that are part of that. So if you compare this now to the cancer care system and healing, there's two dichotomies now that we have, that we're faced with when we not only are been diagnosed with cancer, but because there isn't a recognition of the indigenous healing system, the first place people will seek, of course, is the cancer care system or the Western system. And there it's all technology. And to find spirit in there, it's really, really challenging. You may find it in the practitioner, your nurse or your doctor, or even just a fellow cancer patient who's journeying along with you. So it's much more difficult. This is one of the reasons why we've placed such an emphasis on trying to change the environment in the cancer care system and creating spaces where people can actually have an opportunity to connect to that essence of spirit some way or another. And natural environments do that in a very simple way. So now if you compare that to an indigenous system where the mother of the planet itself, all the living things that's our resource, that's it. So it becomes infinite and it provides hopefulness. The other system doesn't provide hopefulness a lot of times. It's an end. So this slide speaks to the experience of the seeker of healing as a direct effect on the outcome at the psychological level. So whatever your patient is experiencing generally will have a direct effect on that. So if you're not in an environment where you're being supported, or if you feel like you can't connect, it will impact your healing capacity. If you're told right from the beginning that you only have X number of days left or months left, and then believe me, this is not just Indigenous people. I have met with and spoken with, coached and counseled non-Indigenous people who have been given three months to live. And I just say, you got to erase that from your mind, and let's help you connect to something bigger than that. And there are some of them still alive. So this is, we've tried to convince oncologists and that, you know, you shouldn't be talking about end of life until that person comes to you or they're ready. Many cancer survivors, while they're grateful to have received treatment, also speak of the trauma that they've experienced. And so we as healers, if we contribute already to the pain and the anguish and I guess the trauma of an individual as traditional healers, we have to pay for that personally. That's one of our principles. If I re-traumatize and I harm somebody with my medicine, then I pay for it, but not only I pay for it, my future generations do. So this is where that accountability comes in for us. That's why we're extremely careful. Traditional systems of healing have a very important role in healing the spirit. And I think that this is perhaps maybe in the psychosocial field. How do you include that, and how do you make it possible for people to have that space where they can go and connect with their spirit, but also this is where other cancer survivors play a really big role in supporting one another. Family are often left out. A patient is a patient, and really oncology doesn't necessarily look at cancer as a family experience. They look at it by patient by patient by patient. And this is one of the really big concerns when it comes to Indigenous people. Having interviewed different patients, for example, children are looking after their adult parents or their parents when they're enduring cancer. And so, but they're excluded from the treatment plan. There is usually no supports or in place for those caregivers that could be as young as 8 and 9 years old. And so some of the folks that I interviewed in the Pathways Project spoke of that. Now we look at research in Indigenous knowledge and the psychosocial experience. So historically, research has all been in the palms of Western academics, and we're now seeing a real shift in that. However, what we still experience is this need, or I guess a requirement of us, is that we have to prove ourselves. And we're still not seen as being capable of having an independent contribution to the research field. So Indigenous peoples were just now starting to establish a foothold in their research, and it's an industry, really. We have to consider it an industry. And maybe that's why. Indigenous researchers, we bring a very complex worldview which challenges the mainstream methodologies. And we found this, Dr. Latender, myself, and I'm sure Dr. Garvey was also talking a little bit about that, but oftentimes we end up doing a lot of teaching and explaining, and some of the work that I've done, I've utilized diagrams and models that based on information that I've gained in ceremony, but also from the dream world, and trying to bring the concepts and how we look at things and how we understand it from a research perspective. Because we've always had inquiring minds, we've always had a need to know, and to keep records and to collect data. However, it's done in a way I don't think that Western researchers really comprehend fully. Can you imagine trying to bring all of your compilation of information in an oral way and present it to a master's without having papers and that. You know, the mind had to be very, very broad, and you had to explore. It wasn't, you couldn't be just centrally focused. You had to have a real broad ability to be able to look at all different angles. This is one of the reasons why we utilize ceremony and research, because you have to be able to go and see and experience even physically yourself, and then test from there. And that's the part that I think maybe in the future people will be able to do that as part of the research. Who knows, but we'll see. The psychosocial well-being, of course, of Indigenous researchers is often impacted by navigating that Western system. I know there's been times when I've been completely exhausted, because not only am I trying to establish my footing as an Indigenous researcher, but also when you're having to do multiple things and then you're trying to prove yourself, that's exhausting. It's extremely exhausting and emotionally draining at times. And then they wonder why we get emotional. But, you know, I think that's okay. That makes you human. But just so that, you know, people, Western researchers understand that, you know, it doesn't mean that we're weak and we're impartial, and that we don't look at our science and our ways of knowing with a critical eye. It just means that sometimes the physical body just gets tired. The Indigenous researcher expends a lot of energy, and this is, I think, what I'm trying to emphasize. And so, you know, we're always trying to safeguard our knowledge. We're always trying to safeguard our ways of knowing, our ways of approaching things. And it's really unfortunate that when we enter into the Western space, because of the history, because of the exploitation and expropriation of knowledge and information, it's really difficult. Sometimes we can't share certain things. So I guess in concluding my presentation, you know, gains have been made over the past decade. As we see that now, a lot of our Indigenous research academics are breaking those barriers, and however, those inequalities still continue to persist in the research field. And one of the areas, of course, we don't have as much influence or participation, for example, in treatment research. We haven't had the opportunity to even take some of our methods or our ways of addressing cancer and to really explore that a little bit more, and how it could not only benefit our people more, but others because of the way the system is. The Indigenous cancer data, that's another area. We don't have access to that. It's managed by governments, it's managed by other systems, for example, the cancer care system. So we don't have access even to certain data that could actually help and benefit us more, and where our leaders could have potentially have access to it. Right in all of the work that we've done for the last 5 or 6 years, Dr. Latender and I, it keeps coming up time and time again, is that there's a real call for incorporating traditional healing and traditional supports for cancer treatment. There's a willingness by traditional practitioners and healers to work with oncology. And one of our projects currently that we're working on is looking at oncology champions and traditional knowledge holders and key medicine people that are working with cancer itself. So we're funded by the Canadian Partnership Against Cancer, and we're in the process of working on that project. You know, people are surviving longer that do combine therapy. with traditional healing as well as Western medicine. And most of our elder knowledge keepers that do treat cancer with their medicines, they don't discourage Western medicine. They say, you need to combine. And maybe there's many ways, as we said, was we started this presentation with, cancer is just by the way it's named in our language is a huge thing. So not only one method or one mechanism is going to be able to bring it under control or take care of it. So thank you for the opportunity.
Thank you so much, Leah. There's so much interesting stuff in there, and hopefully we'll have a bit of time in the discussion for more, deep exploration of those ideas.